to medicine. What we're trying to do here today is to reintroduce our herbal medicine phytotherapy in a modern era, at least to orthodox allopathic physicians and dentists. This has been planned for a while. I'm pretty sure that it's going. Okay, just go over and check it. He turned it on.
I see you. You're there.
Okay. Make sure the tape's rolling. That's what I want.
The screen, bro.
You're in beautiful green.
Thank you. Okay, so I think we're going to have a very exciting day today. We have two individuals that have devoted a great part of their life to understand this subject, and it's a rare opportunity that we have today to have them bring this knowledge to us. And it's a knowledge that we can use. It's a knowledge that is talked about in the Bible, and the herbs, like we have in our little brochure, can be of a service to man, and especially ill men. And this is what it's all about. If we can do something for people that is helpful to recorrect their physiology and get them well again, this is what we want to do. Something that's basically non-toxic and in harmony with their life. Our first speaker today is Dr. Ed Alstat. He's a pharmacist, naturopathic doctor, and president of the Eclectic Institute up in Portland, Oregon at the Naturopathic College up there. If you people are not familiar with what they have some wonderful products. They have freeze-dried products, and you should try to introduce yourself to their whole line of things. They are also in the process of reprinting much of the eclectic literature that was in existence at the turn of the century in a modern format and updating some things. Dr. Alstat is currently working on a 2-volume book on herbal therapy, which should be out soon. Ed, when's that going to be out?
It's finished writing, so as soon as the printer gets done with it, probably about 6 weeks.
About 6 weeks, so we can all look forward to that. Without any further talk on my part, Ed, would you like to come up and get started? And if there's anything that you need during the day, just ask me and I'll try to get it arranged so we can do it. And it's good to see everyone here.
Mine green too.
Oh yeah.
Good.
Beautiful green.
Great. Well, let's see. It's going to be a long time, I think, here for 2 days to talk about plants, and I hope I can fill in enough material. Since it's a nice small group, I think that's what I like best, because then my talk I can kind of adapt it to what everyone wants to hear. And also, if I do something that's not my usual habit, which is if I talk slower, then I'll be able to last this whole day, not run out of information. But I've been working with plant material for quite a while. I started out, I guess, whenever I was a pharmacist. I went to the St. Louis College of Pharmacy and graduated there in '69, and then moved out to the Bay Area and worked as a pharmacist there, just in retail pharmacy for about 7 or 8 years. And in my spare time, I was reading the typical pharmacy books, and I started getting interested because I'd also had pharmacognosy in pharmacy school, which is the study of the constituents of plants. And I had that, and that sort of interested me. And it's been deleted from the curriculum now, so if you become a pharmacist, you just basically study a lot of other things. I'm not sure what they've incorporated, but more how they insert IVs and et cetera in hospital care and so on. So I was fortunate in that that stuck with me, this pharmacognosy. And so as I found the time working the case in the pharmacy slow, I looked in these books and kind of realized, well, a lot of these materials come from plants. Of course, I knew that. I mean, I studied that in school, but it never really struck me. So I kept going back to it and thinking about it, and then kind of got interested in organic gardening and did that, and progressed with that somewhat, and one thing led to another, and finally I had started noticing that the patients that were coming in for prescriptions weren't actually getting well. Their families were continually ill. The wife and the husband would usually get the prescriptions, and then their children were getting the prescriptions. And the practitioners prescribing the medication were pretty much prescribing 10 to 15 prescription drugs consistently for their whole clientele. Their range didn't go beyond that. So I wasn't so much concerned about changing the world, but I thought, well, I'm in the same position, because if I get sick, then I'm going to be treated by the same method. And so I started getting a little bit more intense and learning a little bit more about my own health, and found out that in a magazine that there was a school in Oregon called the National College of Naturopathic Medicine. And it seemed like they taught a lot about plant materials, so I also wanted to go there. So I ended my pharmacy career, except that during the summertime to pay my way through school, and I went back to Naturopathic College there in Oregon. For those who don't know what naturopathic medicine is, a brief explanation, it is a licensed, and it has a board, and it has a national board exam, and if you pass the exam, you can practice in roughly 7 states, pretty much unhindered by any pressure from any other organizations, including attorneys and so forth. The rest of the states, some of them are actually illegal to practice in, so if you're caught using the word naturopathic physician, doctor in some states such as California, and a few other states where it's related to Texas, then you can be thrown in jail for doing that. So the states where it's fully licensed, Oregon's probably the best state to practice in, which is where I'm from, Portland. And there you can prescribe prescription drugs also if they're from a natural form. So you can prescribe digitalis, we can prescribe tetracyclines and different things. And this is relatively new that we can do this real legally, overtly, I'd say, because that just got established in the law clearly maybe 5 years ago. So many of the doctors now still don't use the prescription drugs. They still rely upon botanical medicine, which I'm pleased, because I've been on the other side of the prescription counter, and it doesn't lend much thought in using prescription drugs. They're certainly convenient, and they're definitely effective, and there's a prominent place for them in therapeutics. But understanding this natural law of healing is more fascinating, I think, and it makes it a lot more creative, and you can help people, your patients, more effectively applying in that way. So what my talk, the reason I went through this little bit of a lengthy explanation is, I had talked to people about here that I knew were coming, what they would be interested in hearing about, and universally it seemed like they were interested in something which I care nothing about, which is the scientific backed information about the use of plant material, because I really had my fill of that in pharmacy. And when I went back to naturopathic school, I believed in that quite heavily, and I kept still digging into the pharmacology, the pharmacognosy of plant material, and kept going my own way, and it seemed to work pretty well. But I was told by a couple people that I didn't know what I was doing, and a few physicists, and that's why I wouldn't be that good. So after still working with material now for a long time, plant material, I've come to realize that there are other mechanisms of plants that don't necessarily fit that category of scientific information. And very rarely do you get a chance to have a speaker, I guess, that has a background that's as diverse as mine. So I'll have to bore you with my own philosophy instead of going with the totally scientific. But I have written, or I have collated a textbook that Dr. Rana mentioned that deals more with the scientific information, and it spells out in there lengthy monographs which contain scientific data on a number of different plants and how they function biochemically and so forth. And I feel like you can read those as well as I can and get that information from those books. The book also contains a flow chart of the use of botanical medicine. So The book was designed to answer the questions that I seem to deal with every day at Eclectic Institute, which is there our product line includes vitamins and minerals, which we started about 6 years ago, a multiple vitamin and a prenatal vitamin. And then we went more into the vitamin herbal combinations of products. And so that led to it becoming accessible by telephone to a lot of practitioners. I think about 80% of our business is to doctors, and then the other 20% is in the retail market, like health food stores and so on. And I always invite people to call and talk about their cases with the patients and how to use plant material. And it seemed that the question I got all the time was, well, what do I use for this patient if they have, let's just say, eczema? And having studied medicine in naturopathic college, which I forgot to mention is if you have your, well, so after pharmacy school, which is 5 years, I still needed 4 more years in naturopathic college to get my degree. It includes a lot of the same studies as you would get in a regular medical school in terms of diagnostic criteria, anatomy, and so forth, physiology, all the hard sciences. And then the only thing where it really differs is in the modalities, the applications, which includes like nutrition predominantly, hydrotherapy on a small part, electrotherapies of different types, Chinese medicines included in that, homeopathy is included, botanical medicine's a large part. Quite an array. So you become a jack of all trades, so to speak, and master of basically naturopathy, I think, which is, in my mind, what the idea was, is to get the patient well, regardless of the modality used, so that you didn't really worry too much about what got the patient feeling better. You just tried to do your best. And so some of the doctors would specialize in homeopathy and go into that exclusively and try to prove that homeopathy worked in that profession. I mean, using homeopathy as a main modality, and then try to get the patient to continue to use homeopathic principles to create the healing effect. So after I graduated, again, going back a little bit, after I graduated, I went and worked in clinical practice for about 2 years, and saw that what I had learned was very effective. It seemed that patients got well very quickly, too quickly, because then it sort of drove you out of business rather rapidly. And you just had to think, well, is it really this difficult to treat people? So I used all the different kinds of things. I used hot flower remedies in some patients. I used cell salts. I used homeopathic products. I used herbal products. I used nutrition, counseling, manipulation. That's another part of the and so what naturopathic does is it sort of learns about a lot of these modalities. Probably it doesn't get into real depth like the manipulation. It doesn't go into that as completely, certainly as chiropractic. I mean, there's only, I don't remember how many hours, but equivalent maybe 2 semesters, 3 semesters. So you could treat a lot of simple things and some of the more in-depth things right away. And then if you needed to refer, you certainly did, because you realized that some people were better qualified. But well, I think what my real strong point has been is, with my background in pharmacy, has been botanical medicine, and therefore a broad insight to it. So it's not that I'm not talking about the scientific information that I know you want to hear, because I will, probably more than what needs to be done. But the part that I've played in Eclectic Institute then is more of a manufacturer. And in manufacturing, I've come to realize that we try to treat the botanical medicine. We look at it like very under a microscope. We want to make sure everything's exactly right. It has to be standardized. It has to be this. It has to be. We have to know the scientific mechanism of it and everything. And then our diagnosis is lots of times we use a sledgehammer in diagnosing. We're so far off, but we want the pharmaceutical product to be very accurate. So So that analogy brings me back to empiricism and the use of plant material empirically, I mean from historically, so to speak. And the flow chart in the book that I've written, let's see, I brought, it's not bound yet, but I brought some galley copies. I'll give you some idea. Since we're kind of dividing up the speaking, I may have time to, if it's reasonable, to make some copies of this if anybody's interested, and then we can talk about it in depth. But the flowchart has to do with simply taking 5 textbooks which have a lot of empirical knowledge about the use of herbs, and taking from those books and categorizing under conditions under an organ system like the liver what plant material according to these 5 textbooks might be effective in hepatitis. So, and then it's categorized that way. Now, if there's also some other symptoms and signs associated with that, then the farther down through the diagnostic level that you get, I mean, the more diagnostic you get, the more accurate the use of that plant material will become. For instance, you may have, if it says liver pain, there may be a list of 30 herbs in that category. But if there's also, if it's chronic liver pain, that may narrow it down to 15. Then if you happen to do any other signs, it may narrow it down even further. And then finally, if you have some blood work associated with it, it may narrow it down to 1 or 2 plants, 1 or 2 herbs. And the book doesn't cite all of the reasons, but if you go back to it doesn't cite all the scientific reasons as to why those might be used, but if you go back to the original 5 textbooks that were used, they sometimes cite the information as to why it might be applicable. And I had to use a little bit of my own, or I didn't actually write this book, a colleague of mine put that together. Between the two of us, we discerned that you had to use some of your own knowledge in categorizing some of these things, plant material, into why they were effective in certain conditions. It doesn't explain that in this flowchart. It's simply just almost reads like a telephone book. So that, at least in part, is what I'm going to try to do today in explaining some of how the herbs work. Because if you have the scientific information, that tells you one thing, but it doesn't tell you exactly how that functions, so to speak, naturopathically, how that functions with our body's own natural mechanism to heal itself. And a lot of times, no one studies that as far as I know, scientifically or otherwise, that this plant has this, the science says, okay, this plant has this action, it functions on the liver and inhibits this enzyme, produces this enzyme, produces these prostaglandins and so forth and so on. That's fine, it does that. But that doesn't explain why an herb has such a wide range of effects, and why that herb has such a wide range of effects, which is hard to understand, which people told me that I'll never be a good herbalist because I don't get this because it's a strong scientific background, was because I didn't realize that the plant may affect that mechanism, that scientific mechanism, for sure. But if that mechanism doesn't necessarily need to be addressed, this plant has other constituents in it, which it will go and address a different organ system. It may not address the liver at all in this case. It may go and work on the kidney. It may function on the lymphatic system instead. It may have an effect on the digestive system and so on. So it's not going to be strictly a liver or something that affects a bilirubin level or so on. And so that's a brief overview of how I'm going to present it. It's possibly a little confusing. But the other thing is that when I give this, my part of the talk, is I hope that no one starts to get real serious about writing, taking a whole lot of notes, because mine's going to be pretty much kind of get it intuitively and feel it more, as opposed to like trying to get it right here. And I did go yesterday over to I walked through the grounds here, the manicured grounds, and I walked over next door to a vacant field, which is real nice. And there's probably, here's a list, 25 plants that are used medicinally right next door. So if we want to take a break and it gets too boring talking, we can go take a herb walk. So I think it's real good. And
Yeah.
Yes.
I don't mean to interrupt you, but can you tell me what the name of your book's going to be?
Oh, yeah, well, it's called, it's funny, it does have a name, fortunately. It's called The Eclectic Dispensatory of Botanical Therapeutics. And before I get, it's changed names many times. But it's actually, it was volume 1 and volume 2, but we decided now to put it all in one volume. It's going to be a big book, but it seems more fitting that it all comes together. And, so I'll just finish the book then, because I've sort of mentioned that enough. And is that it has a flow chart. It has a toxicology section, which is fairly in-depth. So if you really, after you read the flow chart, you get some idea of which plant to use. You can check the toxicology section and get some idea if there's any toxicity associated with the plant, which I think is important. As far as dosages go, there really aren't too many dosages indicated in the text that I've written. That I found is difficult to be too specific about. And there really aren't a lot of dosages in all the textbooks that coincide with one another, so I've left that out somewhat. But you get a feel for it by reading the books as to what might be appropriate. And then the book contains some information on the doctors, the eclectic practitioners, and some physicians in the past who have taken a lot of information from them, so it gives some idea of the credibility section on these practitioners. There's also some on pharmacy, a little bit on pharmacy, telling you when this plant was official, when it was dropped out of the official compendium, so you get some idea that these things were used for some period of time legally. And then there's some monographs which are large pieces of work on plants, which includes everything from the ethnobotany to the therapeutic indications. Like on echinacea, there's probably 80 pages on echinacea, which includes a bibliography of 250 sightings, which includes all the information on echinacea up through March of 88. Quit after that. Got to be never in the book. So then there's also something on calendula, calendula or marigolds, some people call it. And there's one on cranberries, which is real short. There's not very much information on cranberries. I've looked all over, and it only comes to about 12 pages, but it's there. It's pretty good. And cranberries work pretty well. And then, let's see, I always forget half the book. But all right, so that gives you some background. That took longer than I thought. That's good. Now, I think just kind of get a feel, so maybe some questions and some things about what everyone here maybe wants to talk about, or maybe even if they want, what their background is and why they came. If you guys got any questions, now's a good time to get started, so I have some feedback.
I'd like to find out, I use both homeopathic and herbal combinations, and I find that sometimes they work very well together. I'd like your viewpoint on when you would initiate herbal therapy as opposed to homeopathic, or let's say some of your energetic therapy modalities like cell salt and moth flowers, things like that. Indications for when you just want to use the combination also.
Well, it depends on how skilled you are in any of the modalities as to which, how acute the case is and so on as to what you rely on. But usually I don't hesitate to try them all. I usually try homeopathic, keep prescribing along with botanical medicine right at the start. And I think that the two have a little bit different, well, at least I feel like the two go well together, homeopathy and botanical medicine. And I encourage the use of both of them. There always used to be this big split with homeopathics and botanical therapeutics. I mean, the two were always rivals. They probably still are, but they work well together. I usually start off, if it's a child, I almost always use homeopathics initially. And if it's an adult, I'll use botanical medicine more heavily than I will homeopathic remedies.
Do you feel that it's working on different levels, one on a more physical level, and the other one more on a more sensitive level? Is that why?
Oh yeah, well the homeopathics work definitely, I think, on an energy level as opposed to, and botanicals do too, but it depends upon how knowledgeable you are. I'm only a real beginner in learning, but botanical medicine. But I think if you get to, if you study homeopathy for 30 years, which I think it takes to become a very good practitioner of homeopathic medicine, you study botanical medicine for 30 years, I think you can use, those two people are equally in tune with how the energies of them, I mean, the two cross over very well. So I spent a lot of time with one profession I forgot to mention is a gardener, and that I find the plant material is very active. Smelling the plant, Easter lilies are a good example. They're coming up pretty soon. I mean, those have strong therapeutics in there, just the aroma of them sometimes. And depends on what you're tuned into as to what kind of therapeutic effect you're going to get from that plant. If you have Easter lily and you're more in tune with the chemistry of what constituents line the root, the bulb or something, well, you're going to give that to the patient, but you're going to miss the aroma from the plant that's sitting in someone's house. And so it takes a long time to gather that kind of knowledge about those plants. And so if you're more, so to answer your question, whatever you feel more comfortable with, do. But usually I say use herbs. Well, here's what I recommend. If you don't know anything about herbs, I usually try to use the word herbs and botanicals interchangeably, but if you don't know much about herbs, then what I suggest is you pick one or two plants, pretty much non-toxic herbs, such as dandelion. If you have a long list of patients that are chronically ill, you've been seeing for quite a while, and their condition is fairly well stabilized, give every one of those patients dandelion for about 2 months. And I think that what you'll see is how the plant, what I talked about earlier, about how the plant works differently than what you might expect, is that I believe that every one of those patients that you give a dandelion for 2 months will have a change in their constitutional illness. And it won't be consistent with what science has to say about that plant's constituency. Now, lots of times you'll try to give that plant because the scientific data says, okay, this plant's really good for, has a furosemide, dandelion has a furosemide or a diuretic-like action very close to furosemide. You'll try to give it for that, boost that, and you won't get that effect. Well, that's because the pathology of the patient, even though it appears to be edema, isn't associated with the dandelion can't address that edema because it's a different mechanism. So if you gave Lasix and there's edema, chances are that's going to give you a diuretic effect regardless of whatever pathology the patient may have. So the reason plants differ from drugs is that if you give a healthy person Lasix, since we're on that topic, which is furosemide, which is diuretic, I think everyone knows, you're going to get diuresis from that patient regardless, the healthy patient. If you give dandelion, which has the action much like furosemide in studies on rats in particular, to a healthy patient, you're not going to get diuresis probably in almost any of those patients. You might get some in one or two, but almost none of them will you see that diuretic action. The reason herbs have been classified as inert is because they don't live up to the therapeutic activity that they were sometimes assigned to rather arbitrarily. So historically, they keep getting dropped out of the United States dispensatory or interior medicas of various types because they were tested and they didn't live up to that. Well, in the hands of people that administer herbs who know very little about, but a real full understanding of what their natural flow of I don't really have a word for this, but how the body works naturally and how that plant should be applied properly in different situations has not been defined real clearly. So a plant has, to make it simple, when you give an herb, it doesn't always work just because the person has edema, because you have to understand what the natural flow of the system is, and it changes with each patient. You can't always just give it. Like 10 patients have edema, it's not going to work on all 10 of those patients the same. Lasix will probably always get diuresis from Lasix. So that's kind of the essential difference in those. And so if your patient comes in and has edema and needs to be treated, I might give dandelion, which maybe will have a long-term chronic effect, affect slowly and more positively over a long period of time. But y'all might also give apis and to get rid of water very quickly and to get that off fast. There aren't too many. There are some botanicals that maybe will do the diuretic action quickly too, but not not as quickly sometimes as a good homeopathic acute prescribing will. So sometimes I'll use that, and then some other times I'll use plant material to give a quick action, and then the homeopathic remedy to address the more constitutional.
Question, is that dose related? Like dandelion, when you work at a certain level, did you double the dose and try that?
Well, yeah, it's dose related, sure. Yes, I mean, that.
Is that part of the variable, is what I'm saying? You know, that wouldn't work with 10 patients. Would that be a
Right.
variable? that's
Well,
more
yeah, I'm assuming that well, certainly it is dose related. I mean, I think that lots of tests, people are asking for, strict dose, no matter what the dose is, 40 milligrams a day, 80 milligrams a day, whatever. That's going to work in most of those people. With dandelion, it's 2 capsules 3 times a day, or 1 capsule 3 times a day. And it changes, I mean, it does go up more with people that are maybe more obese, people that are maybe more, what's the word? Toxic, I guess. You adjust the dose more on the toxicity of their own system than you do maybe on just strict weight measurements like you might do with drugs. So, and and also, well, there's more to it, which I'm going to go into. Some of this is kind of basic, but I really think that the basics are important because it deals with this under the botanical medicine under the microscope, which is that if you're going to use the microscope, there's a lot of things you don't even know yet about herbs that need to be addressed that sound possibly real fundamental in this talk, but will make you more of a rounded practitioner in the sense, because a lot of the times the pharmacists in the past, when it came to plant material, used to get samples in their Eli Lilly. Well, this was in the early 20s, but Eli Lilly used to provide these little sample cases to the pharmacists, which contained all the crude material in the vial. So when the herbalist, the druggist, got the material in from the supplier, he'd compare that to the sample that he had. I mean, this was using pharmacognosy in its crudest form. So before that, even the herbal doctors would always go out and collect their own material, and they knew what they were collecting, and they would teach people. And it really is important to pay attention to the raw material. That's one of the most important criteria. And we'll talk about that probably a little bit more at length. So, are there any other questions? Gary.
I have that test kit that you made up for me,
Mm-hmm.
and I've been dabbling with that ever since
Right.
Lake Tahoe. And what I was wondering about is when to use like the tincture or when to use the freeze dried.
Mm-hmm.
Another thing is the combination of, say, using a homeopathic of the same remedy that you have a botanical of.
Mm-hmm.
If, like in my mind's eye, sometimes I will use the herb before a meal, the homeopathic after, one botanical and then a homeopathic after. I'd like to know about your experience if that is helpful or what your thoughts are on it.
Right. Well, one of the things that our company does.
And then also, we use organ preparation, so sometimes if I'm working, say in this particular case, your kidney or something, I'll also give an organ preparation at the same time I give the homeopathic one.
Well, ideally, I guess the more in tune you become with whatever modality you're using, the less of it you have to use and the rarer it become. And so, the ideal is to refine it down to one simple thing. I guess philosophically, homeopathy, rings a bell of truth because there's almost nothing there, and it seems like if you're really looking at doing no harm, that homeopathic would be the answer. But on the real level, with patients, it's difficult to have that be applied to most of them. So, freeze-dried, which is something that our company does pretty much exclusively in this country, in the world really, it was brought in because I should address this thing, because in scientific studies, which is something that you're interested in, when you read the scientific studies, you should pay particular attention to, if you're reading about plant material, particular attention about what kind of plant material was used. If it was dry material, great. If it was fresh material, great. But note that there's a difference between fresh and dry, the same as there's a difference between grapes and raisins. They're not the same. You can take grapes and make grape juice. You dry the grapes, you'll never get grape juice back again. So you think they're the same, but they're not. And so with freeze drying, we try to preserve constituents that are more consistent with the grapes, as opposed to drying that same plant, coming out with things that resemble a raisin. There's nothing wrong with the dry material, and there's nothing necessarily completely right with freeze-dried material. They just preserve or maintain different constituents. And the Chinese most always dry material, and then they process it quite extensively. And through the thousands of years of use of that plant, those indications are very clear. So if you take a Chinese herb, and then and you use it fresh, well, you're going to get different indications, completely different than you got with their process. No one system has every answer. So with tinctures, also it applies that companies make tinctures from dry material, and companies make tinctures from fresh material. There's also different methods of manufacturing. There's solid extracts there, which are more concentrated, and then there are fresh plant tinctures, which are not as concentrated as it would appear on the surface, because you've got, well, if you ask me a question, I have to tell you how to build a watch here, just so we get it all. But the typical, here an example. This is a tincture. This is made up, this is echinacea actually. This is what we almost always did at our company was make fresh material. And if you took a fresh plant and squeezed out all of its juice and stuff, you would almost fill this bottle anyways. So, but when you take out all the crude fiber, I mean, you squeeze the juice out and put the fiber in there, you fill the bottle. So you have, this is 1 ounce, so you have an ounce of herb would fill that bottle up. But by the time you take out all the crude fiber and everything, of course, it diminishes the bottle, but you still have the fresh material minus the fiber in the bottle. And then we bring that up with alcohol and water to what's called 1 to 5. So 1 part of the tincture, 1 part of the plant material is contained in 5 parts of the whole thing there. So roughly, it represented the dry weight. So you have 30 cc's, you probably have 1/5. In 5, you have roughly 6 grams of dry material. Now, a fresh material, you have the equivalent practically of 30 cc's. But you threw away a lot of fiber, but you have the equivalent of that. So what that comes down to then, this is getting a little bit poetic, but it roughly comes out to this. So if you come down to that, then you have really 1-to-1 based upon the fresh weight. I mean, a fresh plant, 1-to-1 process. Now you have 1-to-1 because that's grape juice. Now if you take, just to give you an example, now if you take raisins, the same thing, and you dry them, then you can make fluid extracts from them. Fluid extracts are usually made from dry material, but ground up, either alcohol and water mixed or minced from, and then it's processed, percolated, filtered, and seen. Done the same way as this, except the starting material was dry versus the starting material was fresh. And then you, even though you use dry material, you still pull off the insoluble fiber and throw that away. So when you get done, you have a 1-to-1 thing here, which means that there's 30 grams. It was made from 30 grams of dry material. So with the fresh thing, it was made from 30 grams of fresh material, but when you dry it down, there's really only 6 grams of dry material and 30 grams of fresh, usually, rule of thumb. So that's the difference. Now, the can, which is kind of an important part of understanding dosages overall, is, well, if something is more concentrated, it must be more potent. And probably, I guess, philosophically, we believe that, I mean, not philosophically, but seems realistically we believe that because we always think it's stronger if it's heavier, thicker, or there's more of it. But then I think people who use homeopathic medicines and realize the more dilute, the more powerful it is, and so forth. And you can also realize that if you take raisins, no matter how much you concentrate them, still isn't grape juice. There's something missing. So it doesn't equate that the stronger something is, the more material that's in a bottle, the better it is. It isn't. They just have different actions. So that's what makes sometimes dosages confusing too. and therapeutics, indications, and actions. And that's part of it. Goes back to when you read scientific data, be sure to pay attention to the raw material used when you're talking about plants, because it makes a big difference. And then if you're trying to get accurate results with the use of things that you order from other places or applying, you say it doesn't work. Well, it doesn't work because you didn't pay attention. And it's not the plant's fault. It's probably a problem with the indications or with not understanding what the manufacturing process was.
So sometimes I have the equivalents in the freeze-dried and also in the tincture, and we'll check one on the EAB and it doesn't check, and the other one checks. Should we be led to believe in our novice ideas at this particular time to use the one that checks with the EAB, even though that the powdered one sometimes you've heard may be more effective?
Oh, well, I've never used the EAB machines particularly. I've been around practitioners who have tested them out and things like that, and I think they're a good tool to get some intuitive idea about what plants use. But you need first, I think, in order to answer that question, I think first you need to get more familiar with the actions of the plants in general, so that, because I can't answer when one's going to be better than the other unless I understand. I'm sitting there with you with the patient, have some idea of what the problem is with the patient, and what constituent is in that plant that might give a mechanism that is more appropriate for what's stopping them from getting well, which might be a blocked bile duct, even though they may have bloating, but that from maldigestion, giving them more of something that's going to have a digestive action isn't going to help as much as something that will dissolve thin out the bile in the duct. So even though the two plants, and I think maybe what you're asking is, even though that you have a tincture made from an alcohol and water, and you have a freeze-dried, you have plant alcohol is incompatible with some constituents, so you're going to lose constituents in that. Freeze-dried, it is different than this product somewhat. So they have a little different chemical constituents. So yeah, maybe the machine is discerning more clearly which one is more specifically indicated for that condition. But you need to get a little bit more familiar with what the differences between the two, what the mechanism of action might be. For instance, tincture of hops would be good for a sedative, but freeze-dried hops is can be a sedative, but also has a stronger muscle relaxing effect. So it'd be a sedative, it'd be a calmative or sedative in the effect that it helps relax the muscles more so than the tincture would be, which is more directly neural.
The question that Gary had has come up before, and it's my understanding that you should use either alcohol or water or a combination of those two when you make up a test substance for EAB, because it has the ability to more or less amplify the signal or to carry that charge better. Like if you have a dried material, you may not get the same kind of reading. But that we just have to do a lot more work and experiment with it.
Well, so you say, I think we talked about this once before. You said you have a problem with maybe the freeze dried not testing out, but freeze dried is only might be the problem is that freeze dried only contains about 2% moisture versus dry plant material, which is anywhere from 10 to 12% moisture. So there's not much conductivity in that substance that might be laying in the machine. I don't know if that'll affect the testing of the product. I don't know what it takes. So a little bit later I'll talk about some of the clinical studies and some of the double-blind studies with using freeze-dried nettles and how that versus dried nettles, and give you some ideas of what the efficacy might be, what the difference in using tinctured nettles versus freeze-dried nettles, and how you might discern when to apply one versus the other.
There's a difference between drying and freeze-drying too, you say, right? Because
Yeah.
some dry something as opposed to freeze-dry. There are also going to be different indications also, is that true?
Right. Well, freeze-drying, what we do with freeze-drying is we collect the material fresh. So we go out, and let's just say it's nettles. We go out, collect the nettles about another month. They'll be about knee high and cut off the top part of the plant, about the top this much of the plant, which contains mostly the leaf and some of the stem that's real juicy. And then put that in a flat tray and freeze it, and then ship it to the freeze dryer fairly soon. Sometimes they take it there fresh, but usually you freeze it first. And then what happens is they put it stays frozen. They put it in these like baking trays, on these baking trays, and they put those trays on top of a rack. It's like a series of racks, and you kind of push this whole cart right into the freeze dryer. And these racks the trays are just stainless steel trays. The racks are usually, they have heating coils in them, but you don't turn on the heat until the very end. So the material goes in there frozen, and then they create a vacuum inside the chamber, the door's sealed, and create a vacuum, and then they introduce the cold that goes like to minus 70 degrees centigrade. And what happens with that is that you get sublimation real fast. So the cold and the vacuum break open the cell wall of the plant, and then the moisture that's in there is rapidly extracted within a second, or I don't know how fast it goes, but and then what that leaves is the cell wall completely intact, just like just pull the tablecloth out from under a tray of dishes or something, all the dishes stay in there where the moisture's gone, but the cell's still the same. Same size, everything doesn't shrink. The dry material, the cells gradually shrink, and also in the dry material, you create a lot of oxidation within the cell as it's drying. You can create somewhat what we call composting somewhat, because it depends on how well it's dried, how quickly it's dried. Also, you degrade the enzymes die, etc. With freeze drying, the enzymes are not destroyed; they're still active, so you can rehydrate the product and get the enzymatic activity back. And the main thing that freeze drying was used for was because it readily rehydrates. So it was great for certain things. They use it. It was a blood expander. They freeze dried that. I think it was blood, some type. That was the initial application, and they like a blood expander they used it for too. And so in the food industry, then it became real good because you could mix it in a lot of soups and gravies and so on for instant foods and so on, because it hydrates back real quickly because the cells absorb moisture so fast because they're still intact cells and they rapidly rehydrate because they're big. So if you take I had some samples later when I got into this a little earlier than I wanted to, but anyway, then your plant material, your freeze dry material is as close to fresh as I think you can get it if what you're trying to do is to get the action of that plant material for some reason. You found that fresh material worked best in this condition, while freeze dry would probably be the best material to use because it's going to be closely resemble something like if you've got information from the Native American Indians who went out into the woods and ate the plant right off the stem of the thing, used it fresh, then freeze dry would be close to that. So that's the reason why we apply that. And also we found new indication for plant material that can be dispersed globally and maintain that high level of activity because it's been freeze dried, where before that technology has never really been available. Lots of times the technology of preserving the fresh plant in the eclectic medical field was alcohol was the only preservative they really had. So they took the fresh plant material and put it in alcohol. And that has a lot of drawbacks chemically speaking. So hopefully freeze drying will expand the therapeutic application of plant material because it's allowing it to be available on a fresh basis. Now a lot of information has to still be brought down and clinically applied and tested on machines and so forth. And we're going to discover new applications for plant material that weren't before available to the mass majority of people. If you're your own herbalist, you go out and pick your stuff out of your garden, you can use those things yourself. Sure where it fits. So that's kind of answering part of that question you had. Right, Kevin?
If you're going to use them, does it make sense to use one, like the herb before a meal or the homeopathic after? Or
well, it depends upon Homeopathically, I mean, there's a lot of little nuances about that as to when you use it. You don't use it with food, particularly, and so forth and so on. Botanically speaking, there are some plants you use before meals and some after, and it varies when. If you don't know, I think the best time to use it is probably right after a meal. Yeah, or well, not right after a meal, but I usually wait about an hour after the meal as a general rule, as opposed to taking it on an empty stomach, which can be a problem. If you're using tinctures, alcoholic tinctures particularly, that's not so much of a problem because that's absorbed very quickly. It's not nearly as upsetting to the digestive tract, so you can use that before a meal. The reason I don't give them capsules and tablets before meals is they can be irritating to the stomach. Of course, if you're using something that's supposed to stimulate the digestion, etc., and so forth, then you want to take it before meal, of course. How are we doing on time,
And they have the time.
So 10:02.
So
I'll
probably
go for about 15 more minutes.
Okay. Yes.
There is in the herbal area a great deal of concern about environmental pollution and contamination affecting the quality of herbs even coming from China. And, how would you address this, and how do you discern whether an herb is contaminated in your particular system?
Well,
$64,000
no, I'm glad you asked that question because that's part of my thing I lined up here. But that's actually an important part of it too. The plant material, well, plant material that we use mostly in our company comes from the U.S. There's a few things that don't, like myrrh. I haven't found anybody growing myrrh here in this country. And Aviarco comes from Brazil, South America. So I never trust anything that comes that I can't get to the point where I can see the material growing and be harvested. And then if I have to leave that area, then I generally believe that it's going to be contaminated no matter how strongly they say it's not. So usually we don't, we try to indicate when something's grown organically as far as I can make those, when it's grown organically and when it's commercially harvested and so forth. And the freeze drying, we've tried this freeze drying material, which is only cultivated or grown in the U.S. And then our company is pretty small. I mean, it's compared to, we do probably 1/20 the size of most of the large encapsulated herb companies and so forth. And so monitoring raw material is not a problem so much. I've got some more, let's see what my slides show. Maybe it'll be a good time to show that. I'll just wait. Well, anyway, if you go to answer the question directly, then if you go to a grocery store and pick up some herbs off the shelf, the spices and so on, like cayenne, oregano, and thyme and so on, and you probably have some impression that, well, there's these people out there over there in Chile or Hungary or somewhere picking these herbs off one by one, putting them in a bag, and then they're all clean, and then the FDA inspects them and they're on the store shelf. Well, that's probably one of the biggest problems with plant material, particularly herbs, that there is, because the FDA doesn't classify herbs as a major food source like they do tomatoes, lettuce, so on. So the amount of contamination is not as significant because we use them in small amounts. So the boomerang effect from that comes back to some plant material if you're using imported herbs very heavily, because there pesticides, herbicides that are banned in the U.S. are sold in third world countries and then applied there, and then they're brought into this country and they're almost never inspected because they're not a major food source. So they're highly laden with all the things, 2,4-D, DDT, etc., and so forth. And there was a pretty nice article one time written in Harrowsmith back in, I think it's probably about 4 years ago, called the Herbal Ricochet, and it outlined some of these things. And they had tested oregano in different places. Like I went to grocery store and got it, went to a health food store and got it out of the jar, and different places like that, and found that all of those pesticides exceeded the levels, standard levels, by at least 100 times what was generally indicated. And in the ones that you think are probably, and actually the one that ended up being somewhat better one was one that was found in a grocery store, like a Safeway or something like that. Those weren't as bad. So it depends on where you get it. But places like Hungary, Argentina, and Egypt are the major chamomile producers. Greek and Turkey and Mexico produce oregano. Sage comes from Albania and Yugoslavia. India produces ginger and turmeric. And ginseng products are South Korean exports. So you understand maybe what the applications of pesticides are in those countries, then it's good. Then you know what's being used. And about 20% of the pesticide exports that the U.S. Sends out have been banned by the regular EPA in America. So things are going out of this country that we can't use here.
How do you test?
Oh, how do you test? Well, we don't. You can test pretty easily for pesticide residues. It's not that difficult, but you can't always get them all out. I mean, you can't always test for all of them. There's probably 250 different pesticide
You would
residues.
say it's a laboratory, is that what you're saying?
But yeah, you can. You can send them to standby. But we don't test for pesticides, except on myrrh and the ones that we import. Polyarca. There's a couple others that we do, that we make tinctures from. We don't. Most of our tincture, our usage, the raw material we use in tinctures isn't that great. Our raw material we use in freeze-dried is pretty heavy. So we don't standardly test for that. What we do is have a system of collection and cultivation and growing that does our standards and things. It's usually what I call organically grown. And then there's also certified organically grown material, which then has to meet certain standards that are already laid out by the state, either California, Oregon, or Washington right now. And then if we collect in the wild, we have standards that we ask the collecting people to meet. And usually, this may sound like it's a fairly large system, but we only have about 2 people outside of Oregon who collect raw material for us in the wild. One's in the Dakotas where we get the echinacea, and the other's in Hawaii where we get ginger. So most of our things are pretty closely grown.
One last question for him. I didn't interrupt you.
No.
Okay. We're going to take a break, but I'd like everyone, this is a small group, I'd like everyone to get around and meet each other. And I'd also like you to go support our exhibitors and buy some of the literature out there if you think you need any of it, because the organizations need support. We'll go into a little bit about our organization later on, but we also have some books. We have Dr. Weiss's book on phytotherapy, which is a new translation from Germany. We have it available in the bookstore. And then Dr. Mowrey's got his new book on guaranteed potency herbs, and his other book, Scientific Validation of Herbal Medicine. You can just see him if you'd like to buy a copy of this. But you can see why Chinese medicine is, or herbal medicine is practiced by the Chinese is so extensive. We have every plant is useful, and some of them we don't even know the names of yet. So, it's like in homeopathy, everything in the universe has therapeutic utility if you just know how to do it. Yes, Mark.
Can we just get everyone to just stand up and introduce themselves?
Yeah, why don't we do that right now? We'll have a name tag, but it's good where you're from and whatever you want to say. Why don't we start with the young lady next to you, Vaughn? We'll go around that way.
Dorothy Kemp from San Jose.
Okay, and are you in the health professions, or are you just interested in herbs?
Nutritional consultant.
Nutritional consultant, okay.
I'm Vaughn Hirata from Santa Monica. I'm a dentist in Santa Monica, California.
I'm Bill Wolf. I'm a dentist in Albuquerque, New Mexico.
I'm Cecilia Castiglione. I'm an RN. I work in Dr. G's office in San Leandro, California.
I'm Lester Rose. I'm an MD from San Jose.
Gary Bassett from San Jose, California. Bob Battle, I'm an MD from Houston, Texas.
I'm Lynette Lasher from Fresno, and I'm a dental hygienist and learning all this new stuff.
Hey, this is where the old comes new again, you know? This is what we forgot the first time around. Go ahead.
Steve Odell, dentist from Mowrey, California.
I'm Vincent Mark. I'm an MD from California.
And Hawaii.
And Hawaii. And Hawaii, yeah.
I'm Charlie Lee. I'm from Phoenix, sunny Phoenix. I'm a dentist.
I'm Jim Lure. I'm from Omaha, Nebraska. I'm a dentist in nature.
I'm Dan Mowrey, I guess you'll hear from me.
And the fellow in the blue coat?
Oh, I'm Bob Wareham from Wareham Enterprises, and we're over in the...
We want everybody to go visit the exhibitors. I think we got, what, 2 today? And we'll have maybe, Metagenic's supposed to be here, right? But I haven't seen him. And your name, sir?
Gary Berrigan, I'm a dentist from Escalon and a researcher.
And your name, cameraman?
Jim Colquitt, and I'm a dentist from Ventura, California.
Okay. And the young lady in the back?
Carol Rana, I'm staff.
Okay, let's take a little
She's
break.
the boss.
Let's take 20 minutes, okay?
I know. Tape recorder,
Make it sound like there's a lot of people. With those people in the back, please sit down.
Yes, the people way in the back, please sit down. You in the 35th row from Portland. Our next speaker is Daniel Mowrey, Dr. Mowrey. In 1976, he graduated from BYU with a PhD in experimental psychology and psychopharmacology. He also had many hours accumulated in his work in the fields of biology and biochemistry. When he got out, he became a researcher, accumulating grant money and doing research. Also taught at BYU and was director of research at a couple of places where he continues to do research. He's also a contributing consultant to a health data corporation, which is a database, and he wrote the section on herbs. He's also dealing in these research areas with toxicology and the efficacy of herbs. And as a result, this has led him to help manufacturers develop different herbal blends for these people. And he has also authored 2 books, which he has. This one came out in 1986, which is a scientific validation of herbal medicine. Ed brought that to me, and that's how I kind of got started with that book. And then this has just been published in 2 weeks ago, the Guaranteed Potency Herbs, Next Generation for Herbal Medicine. So with that, I'd like to have everyone bring Daniel Mowrey up here.
Now, you're supposed to keep clapping until I got to the podium. Really awkward. Oh, boy. I feel kind of like Ed, a fish out of the water sort of here in this, within this group. I mean, there's so many of you that know so much about what we're supposed to be talking about that it just gets kind of intimidating. I hope that some of the things I say might be new to you, and if they're not new, at least maybe I can deliver them with enough authority that now you'll believe them. And we can go from there into areas that maybe none of us know anything about, and we'll come out of it for the better or the worse. Whichever way, you're here for the duration, I guess, right? You paid your money, so you got to listen to me. Hopefully, what I have to say will augment the things that Ed is saying, and hopefully will not be too contradictory of the things he's saying. However, I do represent a pretty hardcore scientific approach to this thing, and I do believe that there is room in the area of herbology for basic science and the scientific method, and that the more of it that is done, the better, and that the only way that it's really going to move forward in terms of a worldly progress, if you will, in terms of making an impact on traditional medicine or orthodox medical use is if it has the support of the established way of looking at life, which is through in science, through the scientific method. As long as the best ammunition we have to give is anecdotal or even loosely controlled clinical trials, we are not going to see this particular branch of medicine accepted in the United States. And we can beat our heads against the wall for the next 100 years or 200 years. It's not going to make much difference. Well, eventually it will. When the health of the country deteriorates to the point where people are absolutely frantic to find something else, then perhaps we would recognize and be able to see a return to the basic things, which are hopefully not killing people off by the droves. I believe that science will eventually not only establish the efficacy and effectiveness of herbal medicine, but will also demonstrate the limitations of orthodox approaches. And as a matter of fact, I think that's going on right now. And that is we are in an era where the application of science to herbal medicine can have some dramatic fruits and be of great potential value, because the science of medicine is beginning to drift into areas where herbal medicine is very strong. For example, we have down through the years in science been able to eliminate many very damaging and diseases, from diphtheria, these kinds of infectious diseases that wiped out great portions of the population through the early hundreds or a few hundred years of Western civilization. They're virtually non-existent, and this was a good area for science to get involved in, and I think it did a remarkably well job. Let's put it this way: there are a lot more people alive today than there would be if this particular branch of science had not developed. So it did develop, and it did some good things. The one bug, one disease model, however, is coming on hard times, as you know. Those diseases do not exist any longer, but the ones that are currently here are very resistant to that approach. So cancer is not yielding itself to this model. The diseases of the immune system, or I think there are many scientific medical practitioners who wake up in the middle of the night screaming as they contemplate what they're trying to do with immune system deficiencies, and so forth. Even things like the common cold, which seems like it would be an ideal target for the one disease, one bug model, has not yielded to that approach. And so science is beginning to diversify and look at other directions, and herbal medicine is becoming more and more a part of that target. Another political thing that is happening is that Europe is undergoing right now a sort of I don't know what it is. It's a revolution, but it's in the wrong direction. They have been, throughout the years of this century, they've been very resistant to allowing science to dominate in the medical area to the exclusion of herbal products and homeopathic products. That is changing there now, and more herbal medicine is becoming regulated, and homeopathic medicine is becoming outlawed. And as that happens, then these practitioners, these scientists, are looking to the United States as a possibly fruitful ground for further research and development. And they're beginning to build bases in the States, and they're going to then try to push that forward. The book that I just recently wrote, the Guaranteed Potency Herbs, is and it's sort of a result of that renaissance or that revolution in Europe. These herbs that I talked about here, and I'll mention them real briefly: milk thistle, ginkgo biloba, bilberry, centella, butcher's broom, ginseng, echinacea, turmeric. There are other ones: hawthorn, artichoke, and so forth, pygeum. These are herbs that have been used in Europe for decades and decades, but they've been pretty well accepted there, and they're just part of the regular pharmacy, but they fall under the natural medicine approach. And now that the regulations are tightening up, it looks like these are being targeted for tighter regulation and control. these people are becoming more interested in advertising and promoting their products in the United States. And so we're beginning to see them introduced here. And I think that it's important that we as a population know what to do with them as they arrive, and that we approach it in a wise and careful manner and don't run off down some tangent that can get us all in big trouble. And so that's why I wrote that book. But as these things change, then so does the way that science can help us out. So I think there's some limitations on what science can do, and Ed has mentioned that. The human organism is very, very complex. Being an experimental psychologist by profession, I know very well how impossible it is to determine the causes of behavior. We know an awful lot about what can cause behavior, but we don't know an awful lot about what causes behavior, if that makes any sense. In other words, if one of you were to get up right now and run screaming out of the room and rip his clothes off in the middle of the street, we'd be hard-pressed to explain why exactly that happened. And yet, on the other hand, if we wanted to set up an experimental situation in this room, we could control the environment such that one of you might get up and run out in the street and pull out your clothes and scream. See, there's a difference, and it's in prediction. It's in understanding the underlying variables and being able to control those in the way we want to. And to the extent that we can do that, to that extent we can succeed. In the area of herbs, politics plays a role, as do other things. I believe that herbs are drugs. Some of you went, aha.
No.
On the other hand, I believe that herbs are not drugs. Now, what do I mean by that then? Am I contradicting myself? Well, when I went through graduate school, I learned that anything is a drug. Anything that affects, anything you take into your body through any channel whatsoever that affects the physiological response of your body can be called a drug. It's a modifier of biochemistry in the body. Therefore, water is a drug. Air is a drug. These things are all drugs. In that sense, herbs are drugs. However, as soon as you get out of the ivory tower of the university, you find out that that is not what a drug is in this country. In this country, a drug is just simply anything that the government wants to regulate. That's really true. They don't want to regulate water and air, so they're not drugs. They don't want to regulate foods, for Pete's sake, so they're not drugs, they're foods. Then we have a little category of things that are somewhere in between foods and drugs that are called food additives, and the government decided they did want to regulate those, but they didn't want to call them drugs because they didn't want to control them willy-nilly. They still wanted to let food manufacturers use them without too tight of control, so they called them food additives. But they are bound up by a whole lot of regulations also. And so in that sense, I think it's really a big mistake that we start calling herbs drugs, because as soon as we do that, as soon as there's any movement in that direction, we are just giving the government ammunition to establish regulation and control over them and take them out of the hands of the people. This particular kind of movement is what's going on in the Scandinavian countries right now. And it's been completed in Finland. You go to Finland and want to buy garlic, you can buy it whole, but you can't buy it in a capsule, except with a prescription. Any substance in Finland that has been shown to have, through clinical trials and basic experimental work for that matter, to be active medicinally is put under control. It becomes by a prescription-only item. So cascara and garlic and golden seal and so on down the line, St. John's wort, even ginseng. These are prescription-only items in Finland, and they're out of the hands of the people. In Sweden, the movement is on hand to do the same thing. They're trying to prevent it from happening to people that are in the health food area, but it has momentum. And the rest of Scandinavia has the similar momentum to it. We do not have that problem in the United States yet. And yet in Canada, there are fractions of the health food industry that ignorantly, in my opinion, are pushing in that direction. And I see that problem even occurring somewhat in the United States. So let me get on my soapbox just in a second here. I say, from your perspective, whatever influence you have in the area of herbal medicine, you do not ever allow this particular nomenclature that catch on. Anybody talks about herbs being drugs because they have medicinal problems, we just stop it, because the definition of drug in this country has nothing to do with medicinal value, efficaciousness, toxicity at all. It just has something to do with governmental regulation. Period. So herbs are not drugs. I prefer a classification I call medicinal foods, and I try to push for that whenever I can, as maybe another category: drugs, foods, food additives, and medicinal foods, which would allow us to make claims, limited claims on bottles for medicinal purposes, on labels. Right now, of course, you cannot make a medicinal claim for a food on the label, and as long as herbs are called foods, then you can't do that. But we need to have some growth in that direction. Okay, I'd like to leave that for a minute. You see, I'm taking a rather eclectic approach to this, if you will, which means a really scatterbrained approach. I'm just going to jump around here as I go forward, and if they really want to have this on videotape, they can splice it together to make sense out of it. You have my permission. Otherwise, just erase the whole mess. I want to go into this direction here a little bit and talk about, from a scientific point of view, just what the problems are in designing herbs for therapeutic value. And I've identified 5 factors that I think just kind of an introduction to the area, but I think illustrates some important points that we need to keep in mind during the rest of the discussion. Whether or not a substance is going to work in any given person, that's the question that I'm addressing here. Just because there's a piece of science that says that this herb does this, does not mean that that herb is going to do that in any given individual. And Ed has graphically talked about that, and when he said you give the plant to 20 patients, dandelion root, it won't react, and it'll react differently in each of those patients. He went on to say that it won't be what science predicts. I would submit, as to modify that just a little bit, that science is basically a knowledge of natural facts, natural phenomenon. And so a good science would be able to accurately predict what dandelion root would do in each one of those 20 patients. Unfortunately, like in the analogy with behavior, we do not have access to many of the variables that constitute what that individual's response is going to be, or that determine what his response will be. And so it's our ignorance of the scientific or the nature of the phenomenon that limits our ability to predict what each person will do. If we were to, and then as Ed said, every time we modify plant material, we change its ability to affect things. So that if you have an agent that in a whole form gives one response, and then you extract it in that form, it may give another response. And so when people ask me for dosage information, it becomes very complicated because I don't know what product they might be using. And every product out there is different. Every company has its own way of preparing things. The list of different preparations goes on, and each one of them could affect the response in a different way. Certainly, isolated pharmacological agents respond much differently than whole products. And the nature of medicinal pharmacognosy has been to isolate active constituents, extract them, and use them in medicinal purposes for the enhanced effect that is acquired in that manner. Often when we go back to the whole plant material, we can acquire the same sort of response, but in a weakened state, and sometimes in a more holistically, more beneficial manner. For example, we can use quinine as an example of a drug which is isolated from cinchona. It is very effective anti-malarial. However, you can also use cinchona, which has about the same response on a weaker basis. It takes a higher dose, if you will, to achieve the same thing. It works more slowly, but is not possessed of the toxic side effects of the quinine. And there are other examples of that. Individual differences that occur among individuals account for a great variation in drug effect. You're familiar with the dose-response curve? I'm going to draw it up on the board here because I think sometimes we overlook this. When we look at a description of any particular plant's activities, we look at curves like that. And there are other varieties of curves that I could draw on the board, but they're curves. And what do those curves represent? They represent variation in a population, with most response occurring at the peak of the curve. So you would say that for any given dose, which would be along the horizontal axis, as the dose increases, and you get these effects here, the dependent variable on the y-axis, essentially, most people are the response is going to peak there at that particular dose. Okay, but what about this area out on both sides? What does that represent? That means that there's that many people who don't respond at all on the one hand, and there's this many people on here as this curve begins going down to react in a toxic fashion, or it takes even more effect. So you have people that are very sensitive and people that aren't sensitive at all, totally insensitive to the standard, to the product you're talking about. That's what curves are all about, and that's what the field of statistics is all about, is describing the variation among people. And we overlook that. Why do we overlook that? Well, only because we like a simplified, simplistic approach to everything we do. And it's a big mistake, especially when you're dealing with disease. Because what is disease? Disease is the people at the extremes of these curves, not the population as a whole. And so what works for a healthy person may not, or what works for a diseased person or whatever, may not work at all for a healthy person, and vice versa. And in no area is that more true than in herbal medicine. Great deal of variation just from individual differences. What is I wrote LD50 down there. LD50, what is that? That's your lethal dose in, what does the 50 represent? That means that that's the dose at which 50% of the animals that was tested on died. What about the other 50%? We don't ever talk about that 50%, the ones that are still alive. How much more would it take before they died? It's another example of variation in response of organisms. And it's, again, we concentrate on the simple approach rather than taking the whole thing into account. And then, so that's another factor. Another factor are the particular personal, physical factors that are currently present in an individual, such as their age, their health, their metabolic state, their sex, their hair color. Some people, they dye their hair and their response to certain agents change. So these are current physiological factors, things that are just right now. For example, you can distinguish between hyperactive children and the normal population and the response to amphetamines, right? Hyperactive children, the amphetamines, they respond to amphetamines as if they were sedatives. It's just a current state of the organism, and that state changes from one time in a person's life to another, from a time of high stress to a time of low stress. Herbs are going to respond differently in each of those situations, and they have to be assessed. If we had the capability of completely assessing those kinds of situations, and I think that's within the grasp of science, we would enhance our ability to predict a medicine's effect much more accurately. So that's another factor. Other factors would be environmental in nature. Just simply, in which environment do you find yourself at this time? A rainy day, a sunny day. Maybe some of you are familiar with the interesting research that was done by Schachter and Zinger back in 1962, in which they administered what did they give? think it was an adrenaline analog. It was essentially adrenaline. They were given a dose of adrenaline thinking they were getting vitamins. Then they were led into a room, and in one group of individuals were led into a room where the other person in the room was very depressed and down and gloomy. And the other group of individuals, one by one, were led into a room where the other person in the room acted very happy and up. The person's response to the adrenaline, of course, is just an increased general physiological response. So then they were then asked, what accounted for your heightened emotional response to your situations? What did they attribute it to? They didn't attribute it to the adrenaline. They attributed it to, I felt really happy, or I felt really down. The circumstances in the environment are what determined their explanation for their behavior and for their overt behavior itself. And so it is in real life situations. We are affected by the environment about us, and our behavior, our response to chemicals changes with our environment. Ask anybody who's ever used marijuana. Even banana peels, for Pete's sakes. What are the kids abusing nowadays? Cough syrup. Right. Robitussin D or something like that. You know, they're overdosing. You go into a grocery store, and if you look around, probably down here in California, you really have it a lot. But, look over in the cough syrup section and around the store, and you might see an empty box, and then somewhere else you might see the empty bottle, and the kids are wandering around the store. Hey, man, I got a buzz off of that. But it's their environment that's producing this buzz, and and that's the way it is. Highs from marijuana and alcohol and these kinds of things are the result of an environment quite often. And there have been studies that have shown that Oriental people respond much better to acupuncture than Western people do. Maybe it's a state of acceptance, a state of belief there, a state of social acceptance, if you will. Historically, cultural and environmental beliefs and expectations can be extremely strong in producing physiological responses. And then a fifth factor, a final one, would be psychological attitudes and beliefs and so forth that a person might experience at any given time. The placebo effect is, of course, the predominant one here. And the more research that's done on the placebo effect, the more certain we are that it is an extremely powerful effect. Why is that? It's because you can't separate the mind and the body. That's why. They interact, and the state of one depends on the state of the other. And there are some really good reasons to believe that much of the curing process, if you will, the healing process, is effected through the effects of the mind on the various systems of the body that depend upon proper function in order to produce their changes. The levels of neurotransmitters in the brain, for example, is a function of the state of the adrenal cortex, and this of course is subject to psychological factors and how it operates. So you get a roundabout approach to it, but everything seems to be interrelated. Every system depends on the health of other systems and so forth. The response of individual cells it depends upon what's going on in the cells about it. Psychologically, you can, through behavioral manipulation, get people to control their blood pressure and their blood sugar levels and various other things, basic heart rate are some of the simple things, but certain biochemical processes of which we have absolutely no inkling that they're going on consciously through proper biofeedback mechanisms can be brought under automatic control. So that it's all there. None of these things can be overlooked, but hardly any of these things can be assessed in any given situation. And that's where you're confronted as dentists and doctors and so forth with the patient who walks into your office, a living, moving, breathing set of unknown causes and problems and physiological states and psychological attitudes and so forth, and he walks into your office and demands to be cured. And hence the predicament of the health practitioner in this country who knows that he is under contract to this person, but just simply by their walking in his door to cure them before they walk out the door. all right? Very untenable position for a physician to be in, is that sort of a environmental situation or belief structure. So what are you going to give them? Well, take 2 aspirin, call me in the morning. Because I know you're going to be better then, because now you believe you're going to be better. Because you've come to see the great witch doctor in the sky, and I can tell you what's going to cure you and so forth. So we all make use of that. And being a psychologist, I'm fully aware of how powerful that sort of mental set can be on the behavior and the health of individuals. So anyway, those are some things to keep in mind as we discuss then what science can contribute to this. Yes?
What was the first one?
Come on, you want me to remember what the first one was? That was simply a matter of which preparation we're using. Are we using, whole earth material or isolated earth material, using drugs or whatever we're using? We have to keep in mind that every preparation has its own effects. And so, yes, I was saying, or what was I saying? The science then enters this area in an effort to tease apart as many of these factors as it possibly can, always with the awareness that it will never arrive at what might be called the ultimate truth, but that whatever truths that it establishes can be used by wise practitioners. And that the more of these truths that are established, the better able we will be to predict and cure and treat and prevent disease. Now, when I got involved in it, I'm going to give you a little example here then of how some of these factors interact that may be of interest to you. One of the first projects that I undertook in getting into the area of herbal medicine was to look at ginger root and its effects on nausea and vomiting, diarrhea, these kinds of problems. The 3-day flu, I think, was the first thing that I looked at with ginger root. What I had at my disposal at that time, however, was a route of administration, a method of preparation, if you will, that had never been available to mankind in the past. Never. Ginger root, as you know, is a very pungent substance, something you do not sit down and eat by the tablespoon. You don't pick it up and just eat ginger root. You pay the penalty if you try to do something like that. Hence, man's ability to use this substance in the past depended on his ability then, depended on how he did it. I mean, he could put it on salads and vegetables, he could add it as a powder, he could chew on the root, they could make candied ginger root preparations that were a little better to eat. Liquid extracts were available, but never could you just take gobs of ginger root. The encapsulation technique changed that. As soon as you were able to put powdered herb into a capsule, then there was no limit to how much you could take. So maybe. At least you could take a bunch of it at a time. And so, in reading through the literature, of course, I determined that fluid extracts of ginger were used for colic in babies and so forth, and had possessed some mild anti-nausea properties. But I wanted to see how strong this powder preparation could be.
What about pickling ginger root? That's even
Pickling.
You can eat a lot of that.
Yeah, you can eat a lot of that. It doesn't have the same effect, but I'm going to get into that.
How about ginger root sushi? Is that effective?
Sushi. That's what we're talking about.
Yeah, that's kind of what we're talking about there. It doesn't have the same effect. But I was not prepared for what I experienced either. I thought I would get some enhanced response, but nothing like what I saw. First time to apply it was, in fact, what inspired me to try it in the first place was the fact that there was this 3-day flu going around in the neighborhood. And some people I got it, but I've been studying this, and I'm going to see if I can do anything with this. Because I'd already been involved in one on a previous occasion with kind of tracing the course of these diseases around, and I knew how to do it. So I said, I'm going to follow this one around the neighborhood, around the city, around the state if I have to, and I'm going to find out what effect ginger root has on it. Well, I got it right away. And I tried a bunch of different things. It wasn't just ginger root. I tried some other ones. And ginger root seemed to give a pretty good response, but I threw up and I had the whole thing. But then my wife got it. And she said, well, which one of those things worked the best? I said, well, I think the ginger root worked really good. So she began ingesting capsules and capsules and capsules of the ginger root. And she said, gee, if I take 6, 8 of these things, well, my nausea goes away. And my diarrhea goes away. Or I don't get it. That's what she prevented it. I said, that's amazing. So then I went around, and of course I followed the disease around the neighborhood through the schools, and I started handing out placebos and ginger root, and began to see a pattern developing, and found out that certainly there was some things going on there, which inspired me. Okay, I said, this is worthy of a good, well, let me stop right there. Now, if I had stopped the research at that point, I could have said anecdotally, hey, ginger root looks like it's really good for nausea. Take some ginger root and you can prevent it. Well, in a capsule form, of course. That might have helped some people, but it wouldn't have helped everybody, certainly. Through doing some very intense pilot studies after that, then I was able to determine some of the other factors involved in it. How much could be taken, at what point in the illness should it be taken, what was the time course, what was the dose response curve that I could develop out of this, and the more information I gathered then, the more tightly I could predict what it was going to do for any given individual. Never 100% certain, of course, but it became close for nausea associated with the flu. I knew, after a few months of doing this kind of research, I knew that if a person had that kind of flu and they began using ginger root early on, that they would never experience those phenomenons, and there was about a 90% chance that they would fall into that group of people that would never experience any of the nauseating diarrheic sort of symptoms of flu. They might still have the lower back pain and the headaches, happen sometimes, but they would not have, I don't mean headaches, I mean the muscle aches and the back pain. They would not have the diarrhea and the nausea if they followed directions. However, I wanted to do a good study of this, and I just couldn't picture. I knew what it would take to do a good research study on the flu, but I just couldn't picture me measuring stools and it was just messy kind of research that I didn't want to be involved in. That's for doctors and dentists, you guys, but psychologists were clean. And so,
People study that.
after looking around a little bit, I finally decided that motion sickness would be a good variable to look at, because I could create motion sickness in the lab. People would come to me. I'm sure there would be accidents that would happen, of course, with the placebo trials especially, but I could handle that, a bucket and a mop or whatever. I could make them clean it up themselves if I wanted to. Especially if I use students, So that's essentially what I began to do. And a lot of pilot studies, and pilot studies are really good because they help you identify the variables that are affecting your outcome. And the double-blind placebo-controlled trial, for example, was developed because it allowed you to control a lot of variables that you otherwise couldn't see. But I believe that there are stronger approaches than even the placebo double-blind control, because by saying I am ignorant and I'm going to therefore control as much as I can, you put yourself in a position where you rely totally on statistics for your observations and the conclusions you make, and therefore you subject yourself to various kinds of statistical errors. And statistics can work for you against you. They can work any way you want them to. Essentially, if your group is large enough, you can establish the veracity of almost any effect that you want to. But I didn't have that many people to work with, so I had to control everything I could. And this story is getting really long, isn't it? Didn't want to do this, but I think the point is is good though, for two reasons. After I was finished doing the pilot study, I was able to do a full-blown study. I knew when that study was done that ginger root had this effect on motion sickness. I could predict to a great extent what it would do for any given individual under any given circumstance of motion sickness. Some people, of course, don't respond to it, but I knew about what percentage that would be. Didn't know why, but I knew what percentage. The next step would have been to try to find out why, and science is able to do that. I could do that. Secondly, I was able to publish it. And nothing is science unless it's published. Science, that's just the way it is. If you want to be a scientist and you don't publish, then you're not a scientist. You're just somebody out there messing around in a lab somewhere. There's a gentleman that makes a great aloe vera product, supposedly, down in Texas, who refuses to share his research with anybody. And I told him right to his face, I said, well, that's great, but, what you're doing is no better than quackery. Unless you subject your research to some sort of peer review, to let it be published and let your scientific colleagues examine it, then essentially we have no reason whatsoever to believe what you're saying. So science demands publicity. It demands that things be published. So I published that particular article on ginger root and motion sickness in the Lancet and subjected it to peer review essentially, and it survived that, and it still survives that. And so it's science, and it is a forward-looking step in the application of ginger root. It took an encapsulated brand new root of administration and showed that it could do things that ginger root could never do in any other form. It expanded our uses of the product. Now there are all kinds of encapsulated herb products out there right now that have never been subjected to any kind of research. Essentially, what I wrote in this book was kind of a summary of the research on different kinds of herbal preparations of many different herbs, and but there's no guarantee that an encapsulated product would respond like a tincture that I might have discussed in this book, and so forth. And the freeze-dried thing that Ed, I have to tell you a little anecdote here, at Ed's expense maybe. I was, I'm sure you'll permit this, I was at the last NNFA show in Vegas, a health food store group, and I was wandering around from one booth to the other, and I came across the eclectic booth, and I was looking through some things there, and there was the ginger root motion sickness study there, right there at the booth. And I said, wow, hey, this is kind of neat. Why do you have this here? He said, because we are selling ginger root, freeze-dried ginger root. Well, my question to the gentleman who was there was, but this isn't the ginger root that I used in the study. And he said, no, this is a better one. Well, yeah, it's better. Well, it's a better preparation. Certainly a very sophisticated approach to preparing medicinal plants. But the question is, will it work the same as the old crude ginger root that I use, the old just dried up powdered stuff? And the answer to that question is, it may work better. It may work better. It may not work at all for motion sickness. Unless the research is done, we can't say for sure what's going to happen there. Now, Ed probably has a better idea. Maybe they've done some anecdotal stuff with it already, and with different people and so forth, and could answer that from that experience. But again, unless it's published, we won't know for certain. And so it is with a great deal of herbal medicine. You get it in so many different forms that you are going to experience. You have to experience. There is no way around it. You have to experience an incredible amount of variation in the response of the people that you deal with and in the observed effects of the products. You will then have to determine for yourself which ones of these preparations are the best for the application you have in mind. As we look at dental problems, for example, there are lots of mouthwashes out there that you could use to control oral colonies of bacteria and in a way, any way you want to. I mean, your choice is you have a great variety of herbs that are effective against various staph and strep organisms that you could use in just a mouthwash. That's one way you could do it. It might not work for certain people because certain people might have something more deep wrong with them. Their immune system may just be out of whack, and so what you're doing prophylactically in their mouth is not going to have a great deal of effect on their probability of eventually getting sick. And I want to toss in that word probability at this point because that is essentially what we deal with. We deal with probabilities. We don't deal with any certainties whatsoever. We deal with the probability that you can correctly guess how somebody is going to react. This curve right here is a statement of probability more than it is a statement of fact. Probably the person you're looking at is in the peak of that curve. Probably their response is going to be like that. How probable is it? That's a good question and one difficult to answer. So let's say then that you have a patient who has periodontal disease of one type or another, and you're called upon to try to cure that. What approach are you going to use? Are you going to use a mouthwash? Are you going to use a ginseng or echinacea, something that's an immune system enhancer? You're going to combine those two responses. Are you going to do something with their blood so that you just clean the toxins out of the blood more effectively and more quickly? Or are you just going to maybe use a chewing stick of some kind? Have any of you used chewing sticks, by the way? Ed, you have? What kind did you use?
Swiwa.
Sway what?
Salvatore Prosecco.
Aha, where did you get that?
I bought it from Pilu.
Oh, really?
Yeah.
Oh, okay.
I talked to Mowrey Lewis about it, but she didn't have any.
She didn't have any, huh? Oh, well, good. Well, it's not good. That's bad. We should introduce that into this country, shouldn't we? The chewing stick, for those of you who aren't familiar with that, is a toothbrush, if you want to call it that, used by many peoples in the world, in Africa and Asia in particular, India and so forth, who will use a stick, a twig, a root, or whatever of a given tree or bush. Many different kinds are used throughout the world. And they just daily use that. They fray the end of it by chewing on it and then clean their teeth and massage the gums and the gingiva and so forth. And try to get as much debris removed that way. Sometimes they leave the sticks in their mouth all day long. And their teeth and gums are always in a very good shape. May be related to that. That certainly appears to be a significant variable in the health of their teeth. There are other variables too, but that's significant. We could try that in this country. We do have one root in this country that you can obtain fairly easily that does have some good antibacterial, antiviral properties, and that's the licorice root. And if you want to know how to use that, you buy the root, you take a knife and you scrape the bark off the outside so that you have just the yellow interior part of it. And then you chew on it a little bit, fray the end, and you begin to massage and use that. It should taste very sweet. It's perfectly well suited for Americans who love sweets.
You say antiviral, antibacterial?
Mm-hmm. It has some very good other properties too, by the way. We might get into some of those. But anyway, it tastes sweet, and there's a bitterness in this root that should not be there. And so if you really want to use it, you try it, and you taste the bitterness, well, then take the thing back to the store and say, hey, this is bitter. I want something that's better, some sweet stuff. You should not have to buy bitter licorice root. But yes, it can be used that way. It's good for people who are trying to quit smoking because it gives them something to manipulate. It tastes good. It satisfies many of the variables that are important to smokers, and so it can be used in that fashion. It stimulates interferon and stimulates the immune system through various ways, has good effects on the adrenal glands. And it's just an all-around terrific plant to use. How many of you have heard negative press on licorice root? Nobody in here. Well, that's good. Yeah. You have that? Yeah. There are certain portions, and some of these portions come right out of the herbal community. Unbelievable, but there they are. They're trying to tell us that licorice root is not good for you. That it will cause aldosteronism, that it depletes the body of sodium, and it causes potassium, and causes sodium retention, and so forth. And therefore, you shouldn't use it because the potential for toxicity is there. This is hogwash, pure and simple. If you see it, don't believe it. This is what's true. Licorice candy, as made in Europe, that contains a very concentrated extract of licorice root, glycyrrhizin, or glycyrrhizin, however you want to say it, or glycyrrhetinic acid, does have the potential of creating these problems. But whole licorice root really doesn't. Carbonoxylone sodium, a drug that's used throughout the world as an ulcer cure, created from an extract of licorice root, does create edema and so forth in about 20% of the people that use it. Again, this is an extract that has been highly concentrated from licorice root. Whole licorice root does not possess that property. Ironically, by the way, in the ulcer area, they found that the stuff that's left behind when you take out the glycyrrhetinic acid is almost as effective as the glycyrrhetinic acid is in treating ulcers, curing ulcers. It's called deglycyrrhizinated licorice, DGL. And it's available in the United States now, but for a long time it wasn't. Matter of fact, all licorice compounds have really not been available in this country except as candy. The medicines have been restricted to the United Kingdom and in certain other areas. But there are a lot of research has gone into showing that these are very effective. What nobody's ever looked at from a research point of view is what will whole licorice root do for ulcers? Well, we've looked at all its constituents now. Now how about looking at the whole plant? That's something we need to do. But yes, so licorice root itself is non-toxic, and it may be one of the 5 or 6 most beneficial plants in the entire world. Many more people could stand to use it for its ability to increase the immune system response of the body, to maintain the integrity of those tissues. Yes, sir.
Do you find it helpful to use potassium with that?
No, I don't think so. I don't think there's any reason. If you were going to use the licorice root extract, carbonoxylone sodium, or some of those, then perhaps you would want to use a potassium supplement. The potassium supplement definitely can totally reverse and offset the side effects of the drug that is produced from licorice root. But I've never known anybody to respond that way to the whole licorice root. And there's really no reason they should. But if somebody were worried, a potassium supplement 2 or 3 times a week would definitely take care of it.
Do you see that to use something like this, say with something that will, say with shiitake mushrooms or something to work on macrophages, to take those at the same time, do you see them potentiate?
They would potentiate one another. Most of the immune system stimulants from the herbal kingdom do potentiate one another and work very well synergistically together. So, no problem there at all. Okay, by the way, if you do have questions, just raise your hand anytime during this slide.
That calcium, was that to increase the permeability of cells and help it to help it get into there if you were using it?
And using the calcium, I'm sorry, I didn't really...
Does the calcium act to increase the permeability of the cells so that the herb itself can be carried in faster or better?
No, I don't know. When you start messing around with calcium...
Not calcium, potassium.
Oh, okay. Thank you. Potassium is just simply, the reason you would use potassium would be to offset whatever potassium is being depleted because of it. The potassium its effect from the adrenal hormonal point of view, the endocrines there, that control the potassium sodium balance across the membrane. It just gets out of whack and you begin to retain sodium. And when you retain sodium, you excrete the potassium. So potassium supplementation would just simply reverse that. It would just put the intra and extracellular potassium levels building back up to where they need to be.
When you see somebody that's stressed out and the adrenals are
Right.
You see, in their such a patient, you'll see a real low sodium potassium situation in there in the cellular level. Do you use cell salts to help rebalance that as a quick way to?
Well, I don't use anything, first of all, because I'm not a practitioner. I'm just a research scientist, so I can't tell you what most practitioners would do in a situation like that. Cell salts, I know some people do use them for that purpose, however. There are probably other ways that could be suggested for doing that. I do know, however, for example, that licorice root will have the effect of helping rebuild the adrenal glands. Back in the 1950s, there was a fairly extensive work done in Scandinavia and in Britain on using licorice root to treat patients with Addison's disease, which of course is severe adrenal exhaustion. And they found, to summarize all of that research, I think the best statement that can be made is that if you were to cut way back on your cortisone, the normal treatment, probably a better way to say that is you use licorice root instead of cortisone, but if you have just a titch of cortisone in there, it works a lot better. You have an interaction going on between cortisone and licorice root. Licorice root has the effect of sparing the adrenals, like cortisone does, but when the adrenal sparing effect of cortisone results in adrenal atrophy, right? And that's not good. So the licorice root actually restores health to the adrenal glands because it doesn't rob them of their function. It stimulates their function, and it increases the amount of time that circulating adrenal corticosteroids have to work in the body. And so it takes some stress off of the adrenal glands. But for some reason that we don't know, just a little bit of cortisone added in there creates a full-blown recovery from Addison's disease very quickly that does not then without relapse eventually. Yes, ma'am.
You said that the use of the licorice root is safe. How about over long-term usage, let's say in tea format or something like that, taken on a daily basis? Are there any contraindications for long-term usage of it?
Well, it's not a
beverage, let's say, or something.
Okay, it's not a tonic. And if an herb is not a tonic, then the indication is that you should not use it daily for long periods of time. An herb, say a tonic, is an herb which has the tendency to bring everything into a normal state. And so ginseng, the great tonic, you can use it daily, probably for extended periods of time, even though there's press against that now. I don't believe it. I think that by definition, a tonic is something that you can use for extended periods of time. Everything else that has not acquired that reputation as a tonic through centuries of herbal use means that it is driving the body in a certain direction. And anything that drives the body in a certain direction is putting stress on the body of some type. It might be a mild stress, it may be a severe stress. So just on that basis alone, I would say that licorice root is something that you use when you need it and you don't use otherwise. Okay.
In Addison's disease, as you were talking before, do they use this as a tea, or do they use it as just the raw herb itself?
For what?
For Addison's disease.
Oh, they used it as a, let me think a minute on that. They used it as a pill and as a tincture, and I think those are the only two methods I can remember. They probably injected it in some early studies, but eventually it got onto it was an oral route that they used it. I think a pill or extract. They usually extracted it somehow or other for those studies. Yes. So licorice root, yeah, is a really good one, and one that you should use, I think, a lot in your practice because its effects are so wide-ranging in the body. Yes, sir.
You were speaking of glycyrrhizin as being basically a toxic substance. In Europe and Japan, they have done numerous studies and actually come up saying that it's non-toxic, and have even recommend very extensive studies in the use of it to treat AIDS because of its marked stimulation of the interferons.
Mm-hmm. Yes, it does. Of course, whole licorice root would be expected to stimulate the interferons too. Expected, not necessarily proven. But in response to your statement of non-toxicity, I've got a folder at home that's about that thick of toxic reactions to carbenoxylone, sodium, and glycyrtenic acid, and glycyrrhizin for that matter. But again, that's only in about 15 to 20% of the population of white Anglo-Saxon Northern Europe, if you will, right? Yeah, the Oriental physiology may be different. It may not be toxic to them at all. It's quite possible. But then again, you just have to look at the research on a case-by-case basis, I think. And I'm not aware of the Oriental research that shows that it is non-toxic, totally non-toxic.
Yeah, this was one that I have copies of the letter of the Japanese Ministry of Health corresponding with our CDC on that, and it was the 1987 International Congress on AIDS in which they brought this forward.
Interesting. I have to look into that. Good piece. Thank you. Okay. Other questions at this point on licorice root or anything?